So after 6 months, again he came back to me for follow-up, but this time you see his ALT, AST is quite high, and of course his DNA level is now more than 1 lakh, so very, very high. So next, what to do now? So will you treat now? This is my question. Any investigation we will go for? Probably ultrasound will be required, endoscopy will be required now because it is already a chronic case, high DNA level, ALT is definitely a higher one. So liver biopsy, yes, in some cases, not all the cases, liver biopsy is required. So alpha fetoprotein, yes, all these patients should be done alpha fetoprotein because the hepatocellular carcinoma is always very, very high. We did the ultrasound, it is normal. Then we did the endoscopy. No, it is not working anyway, you leave it. We did the endoscopy, it was also, it is a normal endoscopy, it is not a problem, there is no berries, so this is not cirrhosis. But we did the fibroscan, and this is the fibroscan 26.8 score. That means it is an advanced cirrhosis of the patient. Now this patient is a cirrhotic patient, Hep B related one. So there is no question. We started entecavir 0.5 milligram daily. It is the normal dose for him. So next question I am giving, so when to treat? All of us, we should be very clear. When to treat, always look for the ALT level, look for E antigen, also look for the DNA level, the quantitative DNA. So because if the patient has got Hep B positive and E antigen is positive, this is a one group of chronic liver disease. So ALT is 2 times of the upper limit of the normal. I'll be finishing within time. So DNA level is more than 20,000. You have to treat the patient. There is no doubt about it. If the ALT is not 2 times, but normal level, but your DNA is also less than 20,000, you have to follow them up. If ALT is in between the normal level and less than the 2 times of the upper limit, and DNA is less than 20,000, again, you should wait, or you can go for liver biopsy also. If E antigen is negative 1 here, the ALT 2 times of the upper limit of the normal, but the DNA level is not 20,000 as in hepatitis B antigen positive. Here 2,000 is the limit. If it is more than 2,000, you have to treat the patient. If DNA is negative, E antigen negative, but the ALT is normal and DNA also less than 2,000, you don't have to go for treatment, you just wait and follow up. If it is in between, you can go for either liver biopsy or you can go for follow-up. This is another story. The patient with the abdominal distension presented with upper GI bleed, Hep B positive, and on endoscopy, it is not working probably. So it is a decompensated or compensated cirrhosis. So cirrhosis, if person has got cirrhosis, Hep B, 2 things, either decompensated, if it is decompensated, there is no Hep B, DNA level or anything else, directly you go for the treatment, there is no question about it, or you put the patient for liver transplant. But if the patient is compensated one, so instead of 20,000, you have to think of the 2,000 only. DNA level 2,000, you have to go for the treatment if it is more than that. So this is another scenario, that's why I am putting this slide. So why to treat? Because of this one, from acute viral hepatitis, chronic viral hepatitis, it will go for cirrhosis, it will go for liver failure or your HCC or the patient will die. This is the scenario. That's why all these things what I have mentioned, we have to treat the patient. So there is also the risk of progression of the disease. This is the detailed slide. I'm not
Dr.
going to detail.
Goswami,
Yes,
please
finishing one or two
conclude.
slides. So if also we should remember there is no cure of hepatitis B. We have got some medicines, of course, but these medicines options are there. This is the medicines. I'm not going to details about it. All these options we have got, and we have got the latest medicine, tenofovir alpha-phenamide. One tablet we can continue for almost lifelong. We can treat this patient. So in conclusion, hepatitis B infection is a global health problem. It is associated with fibrosis, cirrhosis, and liver cancer. There is no cure for Hep B, but there is a treatment option we have got. The goal of the treatment is to suppress the Hep B infection and prevent further liver damage. Successful disease management will involve the partnership between the doctor and the healthcare professional as well as with the patient or patient family. And timely referral and family counseling is key for the management. So another on this group, the conclusion, most of these groups who have got accidentally detected hepatitis B is a benign course. Mostly careful evaluation is important with ALT, E antigen, DNA level. Counseling is most important one. Already I have shown the issue. And when there is a doubt, always take a second opinion or a consultant. Thank you. Thank you.
Thank you, Dr. Goswami.